This is Raven, and Raven's come in today for an assessment of her teeth. We'll go and have a look at Raven's face in a moment, but she's actually got quite a bit of a swelling and a lesion on her face. And what we've actually noticed for Raven is that one of her teeth is broken, and turns out that Raven actually really likes bones. And so we think that maybe one of those bones has been a bit too hard and actually broken through one of Raven's teeth. And so what that means is the inside of the tooth is exposed to a really dirty mouth, and what can happen is then we can get an infection and even an abscess, and we think that's what's happened for Raven. So we're going to go and investigate that for her today. So there's a few options for Raven with that tooth. It's a really big tooth that's broken, so it's one of her really major shredding teeth and eating teeth. So we'd really like her to keep that if at all possible. So we're going to have a good look at it when Raven's under, and we'll do some x-rays of that tooth. And if the structures around that tooth are still really good and it's just infected, we have a really good chat to Raven's family about a root canal procedure. And so what that would involve is removing the inside core of the tooth and taking that out, and then filling and replacing it just like we would have root canals as people. And that allows Raven to keep the tooth and still be able to use the tooth, but it's no longer infected and painful and at risk of causing abscesses to pop up on her face. The alternative to that is to remove and extract the tooth. And Raven will do just fine without that tooth. She'll be okay, but it's a pretty important tooth that needs to come out. So the consequence of that is if that tooth is missing, she'll have to change the way that she eats, and that can cause plaque and tartar to build up on her other teeth a bit more quickly than we would expect. And also then she loses the function of that tooth too. So I like to think of teeth kind of like in dogs as fingers. So they use their mouths like we use their hands. So they pick up their toys. They might use their mouth to give themselves like a really good scratch. And so if we start sort of chopping off their teeth, cutting off their fingers, or, you know, in this case, removing their teeth, it's the same as you losing a finger, essentially. And so they can still survive just fine without it, but it does change the way that they need to live too. So it's definitely better to be able to save it if we can at all. Hello, Raven. Hey. So this is the little lesion on the side of Raven's face here, and this is quite literally where the abscess has burst underneath her eye and out through the front of her face. Sometimes, unfortunately, they do come up behind the eye, and the eye ends up bulging out of the face. And we'll get a really good look at Raven's sawtooth when she's under, but I'll just show you now. You can see how much calculus is built up over that tooth where it's broken. And that's what's allowed the infection to enter the tooth and ultimately burst out on her face.